Hi, I'm Dr. Michael Calderwood, Chief Quality Officer at Dartmouth-Hitchcock Medical Center, and I'm here with another update on COVID-19. Thank you for joining. I'm going to be taking some questions at the end, and so if you want to leave questions in the comment below the video or email them to social@hitchcock.org, we'll make sure to address at the end of the update. I do want to start with a quick update on where we are with COVID-19, and I prepared a few slides mostly to help visually depict where things are both in New Hampshire and Vermont. So why don't we go to the first slide. So these are actually depictions. On the top is case counts in New Hampshire, and on the bottom is actually the hospitalizations in the state of New Hampshire, although we're seeing similar trends in Vermont. What you can see there is that our 7-day average for new cases is up to 851 new confirmed cases per day, and that's pretty close to our historical maximum of 868 that we had reached back in December through January of last year. And actually in Vermont, we're now 2.2 times higher than the prior historical max, and we've been seeing case counts increase over the past 2 months. If you look at where things are in terms of hospitalizations, we've actually had a 29% increase in hospitalizations here in the state of New Hampshire, and we are back up to 317 people who are hospitalized across the state as of 2 days ago, and that number has continued to rise. And we're approaching our historical max, where we had 326 people hospitalized in the state of New Hampshire. In Vermont, they've actually exceeded their historical max, and things are still on the rise there as well. What this means is that hospitals are beginning to face fewer beds available for other things and all of the non-COVID care that is needed across these two states. If you look at what's been happening in New Hampshire, we've had declines in both hospitalizations in general care as well as in critical care, and this is causing a lot of concern. I'm going to go to my next slide now. People are asking about schools. And so what's really important for people to understand is we're beginning to see increases again in the number of people that come in for testing that actually end up having a positive test result. It's about 1 in 10 that come in for a test that result in a positive confirmation of COVID-19, but there are areas in southern New Hampshire where that's up to 20%, or 2 out of every 10 people coming in. That's also affecting schools, and so we have a number of active cases in schools as well as outbreaks in schools across the state. And we actually, in the first 2.5 months of this school year, have already reached about 72% of all cases over the entirety of last year. Now, thankfully, most of these cases are mild, don't require hospitalization, but they are affecting families. And I want to highlight the fact that the odds of a school closure is 3.5 times higher in schools that don't have a mask requirement. So let's go to the next slide, because I'm asked as well about breakthrough cases. And then I'm going to come back and work through some questions. But I really want to highlight, most of what we are seeing are cases amongst those who are unvaccinated. We know that if you are unvaccinated, you have a 6 times higher risk of testing positive, an 11 times higher risk of dying. And that is actually mirrored as well in the Vermont data. Vermont is doing a wonderful job of actually reporting on these breakthrough cases. Overall, amongst all the people that have been vaccinated in the state of Vermont, and this is similar in New Hampshire and nationally, only 1.3% of those have had a breakthrough case. Most are mild, and actually less than 3% of those with a breakthrough case have been hospitalized. So overall, that's 0.03% of those who have been vaccinated. It's even lower if you get a booster, and I'm going to come back to that in a moment. Now, I do want to acknowledge that all of this is really impacting healthcare across the state and across the country, and we know that people are frustrated about the difficulty getting in for appointments, for procedures, all the things that we have taken for granted. We are trying to get people in as quick as possible and trying to prioritize those with the highest care needs. But we would love to go quicker, and we ask you please to have patience as we work through the backlog of people that are looking for care that we and others can provide. Now, I talked about boosters, and why are boosters important? Now, the first thing I'm going to say about boosters is there's a lot of information out there about who might need them. We know now the state of Vermont is saying that anyone 18 and older can get a booster, and many states are moving in that direction. There are really different recommendations depending on one's risk. The highest risk for breakthrough infections is in those who are older and those who have illness where their immune system does not develop as robust an antibody response to the vaccine. That does not mean that those who are younger do not benefit from a booster, but they were not initially put at the front of the line. As we have boosters available, we are making them available to more and more people, and I direct you to dh.org to find information on where you might be able to get either your primary series of a vaccine, a pediatric vaccine, or a booster vaccine. And I want to highlight that we actually have clinics that are happening in Manchester and in Chester on November 20th that still have availability. And for those who are interested in pediatric vaccines on November 20th, please go to dh.org to try and find information and to sign up for those spots. Now, what can I tell you about the boosters? Let's go to the next slide. So what I can tell you first is that people are coming forward. Boosters are really driving a lot of the increase in vaccination that we've seen over the last couple months. More recently, pediatric vaccinations have been driving that increase. That's great. We know that younger ages have been less likely to be vaccinated, and we want everyone to come forward and get a vaccine. But I also want to highlight that we need to continue to reach out to those who are vaccine hesitant. It really is the primary series that is going to be critical in protecting our overall population, in addition to the boosters that are now available. Now, people say, well, what if I had COVID? Do I actually need to be vaccinated? And the answer is yes. Even if you've had prior COVID, vaccination significantly reduces your risk of a second infection. In fact, you're 5 times more likely to get a second infection if you don't have that vaccine. Why get the booster? Those who get a booster are 93% less likely to be hospitalized and 81% less likely to die from COVID than those who just had 2 doses. Now, again, there's a time period, and we really are emphasizing those boosters. It's a second dose of the J&J, more close to the first, but really for the mRNA vaccines, it's 6 months after the completion of that first series when you'd be eligible to come in for that booster. Finally, I want to comment on the holidays. Thanksgiving is coming up. We're going to go into other holidays in December. As you think about gathering with your family, there is good data that the more members of your family that are vaccinated, the lower your risk of COVID-19. Why is that important? Many families are asking that everyone who's eligible be vaccinated before gathering for the holidays. Some are asking that people get tested, and this is available. And some are saying, you know, we're seeing breakthroughs. We have people in the home that are higher risk. We want that vaccine. We want people to be tested. And we'd ask that people really respect that. We want people to be as safe as possible as they can. And if people say, maybe next year, if you've chosen not to be vaccinated, that's because everyone is trying to keep things as low a risk as possible and really think about what is right for your family. So I'm going to go through a number of the questions that we've had. The first question we often get is, why is the Delta variant more contagious? And the Delta variant actually has a change in the spike surface protein. A lot of people have seen these photos that are out there on the news, but really this is how the virus invades your cells. And with the changes in the spike surface protein, it actually is stickier. It's able to bind to those cells and infect them more easily. It's also able to evade the immune system a little bit better. And so each person who's infected with the Delta variant of COVID-19 can spread the virus to about 2 times more people than with the original circulating strain of the virus. Another question is about a family member who may be recovering from COVID-19 and when you might be able to see them without being at risk for exposure. So in general, for people who have a normal immune system, haven't had severe illness and been hospitalized, really you're not shedding any virus beyond day 10. And we take people off of precautions at day 10 because we haven't been able to culture live virus after that point. We do know in individuals who have an impaired immune system, either because of medications they're taking or chemotherapy or things like cancer or organ transplant, that sometimes things can last longer. We also see that in severe illness, so people that have been in an ICU for care of their illness. In that case, you may be on precautions for up to 20 days, but really we don't see people transmitting beyond that point. And that's important because the next question people have asked is, well, how long can people really have detectable virus? And part of the answer to that question is the test that we do is identifying DNA. It's not identifying live virus, and after you've killed off all the virus, you can sometimes have pieces of DNA that stick around for a while. And so it's possible that someone may continue to test positive for COVID-19 up to 90 days after they recover, but they're not actually able to transmit to others. This is dead virus and DNA remnants and not able to transmit. Next question. If I will be fully vaxxed and boosted by the December holidays, should I get a COVID test just in case for family with infants? So this really gets at how do we protect those who are not eligible. We're really excited to see the large number of children in elementary school ages and older who are eligible and coming through. I was getting pictures of excited families finally able to vaccinate their children, but we have individuals less than 5 who are still not eligible. And what can we do to protect them? So the most important thing you can do is to be vaccinated. That is how you're going to protect your family. The added layer of being tested is something that some families are choosing to do, particularly if they have individuals in the home that they know are at particular risk, and they want to do everything they can to try and mitigate that risk. So testing is one strategy, but it does not stand in for vaccination. Okay, and then, I think I'd like to talk a little bit about the side effects from the vaccines. So we actually now have incredible data. We have vaccinated billions, with a B, of individuals around the globe. We have individuals who have received 1 shot, 2 shots, 3 shots with the boosters. Mostly what you're getting is a sore arm, very similar to a flu shot, actually less painful than a shingles shot. Some people feel tired. Some people, in rare cases, will have fevers, but it doesn't typically last more than 1 to 2 days. Now, when you are vaccinating millions and billions of people, you will start to see certain side effects that are very rare. And so, yes, we do hear about some of these on the news. But again, I want to emphasize that the side effects that people are talking about are actually much more common with COVID-19 when you get the virus than with the vaccine itself. I do want to address the elephant in the room, which is why am I here in front of you today with a mustache? And the reason for that is we are in the midst of Men's Health Awareness Month, or Movember. And one thing I do want to highlight is that while men and women are equally likely to get infected with COVID-19, men have a higher risk of being hospitalized, of ending up intubated or on a ventilator, and of dying in the hospital. Despite those higher risks, men across the country have been less likely to be vaccinated than women. We hear that people are concerned about what this means for sexual health, reproductive health, one's ability to have children. We actually have good data now. many people who have gotten vaccine before, during, their ability to get pregnant is actually not impacted. But actually what we do know is that amongst those who have had COVID-19, men who have had COVID-19 are 6 times more likely, after they recover from their illness, to have erectile dysfunction, to have issues with low sperm count. And so the vaccine is actually protecting against all that. So if you want to think about reproductive health and men's health issues, the vaccine is critical and really important to step forward. So please think about where you're getting your information. Again, we have many frequently asked questions and information pages at dh.org. And I'm happy to answer any additional questions. If not, let's have a look. I think, let's see, I had both doses of the vaccine and had a booster within the last 2 weeks. Is there still a chance I can pass it along to other people? Well, first of all, thank you for getting your vaccine, for getting the 2 shots and then the booster. That is doing everything you possibly can, and the risk of getting COVID-19 and passing it on to others is extremely low, and we are talking at this point less than 1%. And so you've done everything you possibly can. Again, as we see the numbers on the rise, people may choose to wear a mask when in crowded places, may think about crowded environments where they don't know the vaccination status of those around them. But those are personal choices. With each vaccine, your chance of infection and severe illness declines. Thank you very much.